Now today's video is going to be about the common mistakes that most people make when they treat acne. Are you part of the people that make those mistakes? If you are, don't forget to continue watching this video. If you like the content, please subscribe at the end of this video. Hey guys, welcome back to my channel. It's your girl Nurse Kelly. I create contents around nurses, skincare, aesthetics and lifestyle. So there are different mistakes people make because they are overly conscious of acne, which I don't blame them. It's a constant struggle. Acne is an inflammation of the skin. But when you decide to start treating acne, these are the common mistakes that most people make that you should also try to avoid when you're treating acne. The first mistake would be overly washing the face. Most people, when you start to use skincare ingredients, especially the ones that contain salicylic acid, benzoyl peroxide, you don't want to overly use them on the skin, because using them in high amounts or overly using them on the skin can actually cause the skin to get irritated and overly sensitive. Most times when people start to wash their face, you see that because they feel that, oh, this ingredient is supposed to help me deal with acne, they pour too much of it and they start to wash their face. Some people actually go to the extreme to wash their face 2 times or 3 times in a day with these ingredients, forgetting that these ingredients is supposed to dry out the skin, control sebum basically. So when you start to use this ingredient to overly wash your face, what you're just doing is you're stripping the skin of its normal barrier function. The barrier function of the skin is supposed to act as a lubricant to hydrate the skin, to draw in more water into the skin, and to lock in moisture, to also protect us from the external environment, toxins, radiations, just to help protect the barrier function of the skin. When it becomes compromised, either due to the products, the way you're doing it now by overly washing the face, what just happens is that when you now start to do other skincare routines, you feel that your skin is hot, peppery, you feel that your skin is also red and really dry even after you've applied moisturizer and sunscreen. So that shows that you are definitely making a mistake while you are using these products. So stop overly washing your face. The second mistake that most people can actually make when treating acne would be to consider using DIYs. I know that most DIYs, that you see them a lot on YouTube. Once you open up YouTube, you see someone saying how lemon cured my acne, how this toothpaste cured my acne. But you should actually try to avoid them, especially when you have officially started treating acne. Most people will claim XYZ, this and that helps their acne. Those products do not do anything for acne. There's a video I have up on this channel about things that you should not do on the skin. Baking soda, lemon, they are under ascorbic acid, acidic, baking soda, alkaline. I know that sometimes we hear that, oh, our skin is within a pH level. Yes, that is actually true. Now, regardless of the fact that a product is alkaline or acidic, it may still not be within the pH level of the skin for you to actually use them on the skin. So definitely when you now start to use baking soda, or you use your lemon or any other thing that is a DIY on the skin, you're just predisposing the skin to more sensitivity, irritation, and you're clearly stripping the skin of its normal barrier function. So once you start a routine, or once you are being placed on a routine, forget everything about DIYs and focus on what was given to you for you to actually use them on the skin. So definitely when you now start to use baking soda, or you use your lemon or any other thing that is a DIY on the skin, you're just predisposing the skin to more sensitivity, irritation, and definitely you're clearly stripping the skin of its normal barrier function. So once you start a routine, or once you are being placed on a routine, forget everything about DIYs and focus on what was given to you. The third or most likely mistake that you might be making when you're treating acne is for a quick fix. Remember that these concerns took a long period of time and they've been persistent, maybe from puberty, or it came all of a sudden. I understand the concerns and the struggle with wanting to get it out all of a sudden. But however, you don't want to fall into the wrong hands. When you're looking for a quick fix, you could fall into people that might even make your concerns worse. Acne is a continuous management. When you start to look for quick fix, you are not actually doing the right thing. You may also not get the actual way to use your routine. Acne might take as much as 3 months, 4 months, 5 months, 6 months, depending on the treatment plan and the type of procedures that you would do if you decide to do treatments. That's not being realistic. Try to exercise patience, because there are so many things that could actually cause you to have acne. Acne sometimes can have predisposing factors to it. If it is due to hormones, the hormones need to be regulated or balanced before you actually get to see the best of results when using these products. If there are other reasons why you have acne, it definitely would not go under 2 weeks. Another mistake that you might be doing is the application method. Sometimes when people apply skincare products, you actually wonder if it was the right way they applied this skincare product. If your esthetician says pea size, a pea size is a pea size, so that means very little quantity. Don't go and apply overly too much because you're really conscious of how the acne goes on. The acne would still go with the pea size, so try to apply your products properly. If you are to avoid certain corners of your face, you actually avoid those areas, because those areas are prone to sensitivity. One mistake that you might also be making will be overly exfoliating the face. Certain times you ask clients, oh, how do you apply your routine? And they tell you, I go with my face wash and I use a sponge afterwards. No, try not to do that, because these ingredients, they are already sensitive to the skin, and you don't want to be scrubbing with a sponge or trying to exfoliate physically with these products. Benzoyl peroxide, salicylic acid, these ingredients are ingredients that you don't want to be doing the wrong way. So the best method of application of products would be to take your face wash, 2 fingers, apply the face wash, and then go into your forehead, your corners of your eyes, corners of your nose, and then allow it to sit for 30 seconds to 1 minute, and then you wash off. The best method of application of these products are your hands. Your hands are the best method, so there's no need for a scrub, there's no need for a separate sponge or any other thing like that. So use your hands to actually do your face wash. Afterwards, you wash off your face. Method of application would hugely depend on whether you're doing the right treatment plan or you're making a mistake when you're treating your acne. Would be not to take the appropriate recommendations for you. If your type of acne requires medications, actually try to take those medications if they are not considered severe or contraindicated to any medical history that you might have aside from acne. So certain people might require acne medications, which is why sometimes when people try over-the-counter products and they're not really seeing any effective change, it could also be due to the fact that there might be an underlying medical history as to the reason why their acne has been persistent and reoccurring. You pick and choose which prescriptions you want, and then you dump the rest. There's a reason why there's a curated routine for you. Try to make sure that you actually obey the skincare routine that was given to you. Mistake that you might also be making would be constant touching of your face. Certain clients complain of like having acne at a particular area on the face. They have acne here today, the next few days they have acne directly at the same area where they had the previous one. It could also show that there might be a bacteria going on the skin. You should try to avoid constant contact with the skin around that area. Things like your phones, your AirPods, the hair that falls down to your skin. You should also try to wash your makeup brushes, because those items easily hold bacteria. You actually need to watch what comes to your skin. So like I've said, avoid constant touching of the face. You also want to avoid picking while treating acne on the skin. To stop using products when acne clears. Like I said earlier, acne is a continuous management. Regardless of the fact that your acne might have cleared off, right? It's a continuous management. You're definitely acne prone. There are certain products that you actually need in your routine to make your routine acne fighting ingredients. So definitely you want to keep acne at bay as much as acne has gone. It would be overly using actives. I know that sometimes you can see certain active ingredients in a dermatologist routine, esthetician routine, or aesthetic nurse routine. Sometimes proper analysis might have been done and then it was determined that you need these products, which is why if you look at the routine properly, you will notice that there's a way the routine was formulated. However, you don't want to attempt to use new products randomly. You don't want to just go to somebody XYZ said, oh, this product is good, and then you buy. You actually want to confirm if the product is actually what you need for your skin. My the making is to not see a proper dermatologist or skincare clinic when treating acne. If you have tried treating acne on your own in 2-3 months and is still persistent, please try to see a dermatologist, esthetician, aesthetic nurse to follow up on your treatment. Certain times, most people allow acne to prolong for a very long period of time, and it develops acne scarring, and it gets to a point where the acne scarring starts to leave dents on the skin, eyes peak, rolling scars, that their concerns now move from treating acne to acne scars, which are more difficult to treat and may not even resolve completely. Is to try to use steroid laced products alongside your maybe over-the-counter products or prescription products. This is, however, wrong. You don't want to, in your bid to look for quick fix, mix steroid products and over-the-counter products. In Nigeria here, sometimes different brands that quote unquote say it's an organic brand use steroid laced products in their routine to get quick results. Now, however, you're actually doing the wrong thing, because at the end of the day, steroids are not meant to be used for a long period of time. When you do steroids, and then it will suppress what is actually wrong with you for a short while, and then after a while your concerns become worse than you originally had them. So you never combine over-the-counter products or prescription products with steroid products. Use them without prescription. In Nigeria, there's no proper regulations of these steroid creams, which is why anyone can go and get it off a shelf. That's, we've come to the end of this video. Like this video, share this video, and comment in the comment section which mistakes that you might be making, and I'll respond on how best you can move forward from them. If you want more content regarding skin, please share this content. Don't forget to subscribe, and forget to click on the notification bell when I post new videos. Bye guys.